This is the Aurora Health Alliance topical webinar. Our focus today is legislative priorities. As the legislative session gets underway, there's lots of good stuff to talk about. I want to just introduce our two speakers who will be speaking today. Alli Daley, who's the Senior Behavioral Health Policy Coordinator at Children's Hospital, and Jarett Hughes, the Deputy Director of Policy and Research with the Governor's Office. So thank you both for being here to speak. And
thanks for having the Children's Hospital team. I'll do a quick intro to myself, and then I'll turn it over to Andrea from our team too to do an intro, and then we'll dive in. My name's Alli, and I do all of our behavioral health policy work on our government affairs team. And I've been at Children's Hospital for about 2 years now. And it's great to join this group again. I feel like I stop in as much as I can. Andrea, if you want to do a quick intro too, before we kick it off.
Yeah, Andrea Stojsavljevic, she, her, also a senior policy coordinator on the government affairs team at Children's Hospital. Been on the team for about a year now. And in terms of policy buckets, social determinants of health with a focus on food security, housing security, economic security, which are obviously preaching to the choir, all intertwined. I'm going to be talking about some community health worker legislation a little bit further on. Thanks, Alli.
Awesome. So we just kind of repurposed a presentation that we use for our internal teams, but it felt really relevant to share with you all on sort of what our advocacy priorities for this year are, which include some of the bills that we're looking at, as well as kind of a zoomed out picture of what we're looking at. Feel free to interrupt at any time. I will try to kind of keep an eye on the questions in the chat too, but definitely let me know or stop me anytime if you have questions about anything we're chatting about. At kind of a zoomed out level, Children's Hospital this year is focused on 3 really key pieces, and all of these issues were informed by our community health needs assessment. And continuously, we've really seen a really big priority from our community on mental health issues. So one of the biggest things we're looking at continues to be supporting youth mental health and addressing the youth mental health crisis that we're really still experiencing, and was around before COVID occurred, but is definitely has been made worse by the isolation and trauma of COVID, which I'm also recovering from. So if I sound really rambly, forgive me. I am the brain fog is very real. So just appreciate your patience. Another really big priority that we're looking at and that we look at every year is just looking at expanding access to care. And then finally, removing barriers to health equity. That's where Andrea really comes in and brings her expertise to the table in all the areas of social determinants of health and health equity. So to kick us off, mental health is, like I said, the kind of majority of the work that I focus on in my bucket area. And we really kind of broke this down into 3 spaces. A lot of you are probably aware, but last year the legislature had a significant pool of funding available from the one-time COVID-19 relief funds from the American Rescue Plan Act that the federal government passed. The governor allocated $450 million to addressing mental health at a state level, and we successfully advocated with a broad coalition of advocates for a third of that funding, or $150 million, to go towards investing in youth mental health. So this is really looking at kind of filling gaps along the care continuum, supporting prevention and early intervention, and also supporting services for kids with really high acuity needs that typically are the ones that we see at the hospital, or kids that are needing the kind of level of care from like a residential treatment facility or pretty intensive home or community-based services. So it really included services sort of across the continuum. And one of our priorities this year is just really monitoring as those dollars are starting to roll out and the grants are starting to become available. Just monitoring that work and making sure the money is getting to the bedside and to patients and communities as fast as it can, since the crisis is so acute. Some of those grants have been started to be released, and is something that we're excited about. If your organization is not aware of the BHA right now has a webpage dedicated to where they're sharing where the grants they're sharing where the applications of the grants can be found. I'll throw that into the chat when I'm done talking, if I can remember to do that, but feel free to remind me. And I would definitely encourage your organizations to look at these. One of the first rounds of grants has already passed, but there will be additional rounds, and they're really targeted to closing gaps along the care continuum, really looking at community-based organizations. So definitely something I'd encourage you to look at. The other key piece here is just continuing to monitor the new behavioral health administration and make sure that it really has increased accountability for policy, strategy, and services for children and youth. I think the BHA was built with a really big promise to create a more accountable behavioral health system for Coloradans, and we're just making sure that that promise is. Oh, thank you so much, Emma. Bless you. That is the page of funding opportunities, and I really encourage you all look at that. So yeah, like I said, the BHA has absolutely been a huge promise for the community, and we're just really hoping it fulfills that promise and that goal to create accountable services for all Coloradans. To kind of get into more specifics on bills that we're looking at, the second priority for us is always trying to help make sure that kids are finding the right care in the right place at the right time. And there's a couple of pieces of legislation that we really feel like are targeted to meet that goal. One of the biggest places where we really advocate for kids to be able to receive services is within their schools. So we are anticipating a future bill that's not introduced yet that will support additional funding for school-based health centers and also allow that program to coordinate and work with clinics that are operating, say, across the street from a school, but are not physically on the property of the school. Right now, there's limitations for their ability to be considered a school-based health center, but to look at how those clinics can be supported as essentially school-based health centers. That's being put forward by the Colorado Association for School-Based Healthcare. We're also looking at, we support House Bill 1003. This allows schools to opt in to providing a mental health screening for students that are in 6th through 12th grades. It is optional for schools, but we're excited to see schools wanting to take an active role in screening for mental health needs of their students. And one thing we really like about this bill is sometimes we're worried when we do additional screenings, but the resources aren't actually available for to ultimately provide services. It's always hard when you screen, but then there's nothing available in the community. So this bill right now is going to refer students to crisis services or the iMatter program, depending on what's appropriate. The iMatter program has expressed that they feel like they have capacity to serve additional children and youth who have mental health needs. And iMatter, as a reminder, is a payer neutral program that's available and operated by the BHA as well. Though we're really excited to see that one, and it has passed out of its first committee, and I don't think it has been scheduled for a debate on the floor. Another bill looking at access that we're supporting is Senate Bill 14. That's about the prevention of disordered eating. It's somewhat of a narrow targeted bill, but it is importantly looking at also coordinating with schools to make sure that schools are aware of the resources to help kids who are at risk of disordered eating or are participating in disordered eating, to make sure that schools have those resources and know what's out there, and are not sort of stigmatizing students that have those needs. But this bill also goes beyond just the school level, but that's something we're excited about. It really targeting, and it was designed by youth. So the bill really targets youth prevention of disordered eating, although it applies to any population. And then a third bill in this category that I wanted to flag is Senate Bill 91. This is a bill that ensures that kids under age 21 are able to access behavioral health services without a diagnosis. That's really exciting. There's a 6-visit benefit that you might be aware of that operates through HCPF that allows for kids to get access to short-term behavioral health services without a diagnosis through an integrated care setting, like a primary care setting. That's an amazing program. And this really complements that by saying that rather than only allowing kids to receive services through that kind of primary care setting without a diagnosis, this would allow community mental health centers to also be paid for providing services to kids that have a diagnosis, or just kind of a broader set of providers without requiring a diagnosis. So we're just excited to see another access point and another barrier removed, since we know that diagnoses are still stigmatized and are still sometimes serve as a barrier for people to be able to access treatment. And then finally, our last priority in the substance use space before I move on is continuing to really look at reducing youth substance use. There's a couple bills here that we are active in towards this goal. It includes alcohol, marijuana, and tobacco as kind of a general look at what substance use looks at. For House Bill 1009, that was another youth designed policy that looks at encouraging schools to adopt evidence-based intervention models for students with substance use disorder. So it's going to create a task force that looks at evidence-based practices for schools, and then encourages those schools to adopt those practices for students. And then a bill that we're opposing that's in committee tomorrow is looking at access to medical marijuana. There was a bill in 2021 that we supported that made some kind of added some reasonable guardrails to high potency marijuana products. And this bill is really looking at scaling back some of those restrictions. And it would make it easier for physicians to recommend marijuana products by allowing for telehealth only evaluations. It also eliminates a requirement that a doctor has to review a patient's existing medical records prior to recommending marijuana. So we just have concerns about that sort of decreasing the I think the care and the thought that goes into prescribing these products, and the coordination that is necessary to make sure that they are used safely and healthfully. So that's another one that we're working on and that we are opposed to, but I definitely encourage you to look at it as well, if it impacts any of the folks that you serve. And the last bill, that's Senate Bill 81. Great question. Thank you. And then one more thing before we move into community health workers is just, I think, a zoomed out look at expanding access to care. And this is really taking place on more of a regulatory level. So I just flag that for folks if you have capacity. The Colorado Medicaid delivery system is preparing for its sort of next phase of innovation. This is the Accountable Care Collaborative work. We're in phase 3 of that. So we're working closely in that just to make sure that the Medicaid system is really prioritizing and supporting integrated care and whole person care so that people are experiencing a healthcare system that really meets all of their needs. So this is something that is really happening on the regulatory level, but it is starting, the stakeholding has started from HCPF. So I encourage you to get involved if this sounds like something that you're interested in as well. I will transition us now into community health workers and our social determinants work. Yeah, thank you.
Yeah, thanks, Alli. We can jump in. So primarily today, wanted to talk about Senate Bill 2, which is related to Medicaid reimbursement for community health worker services. So going to provide a little bit of context around why this bill, the coalition work to date, and then some of the content bill. Similar to Alli, feel free to interrupt in the chat or come off mute. I'm happy to answer any questions on this one in particular. In terms of starting off on the same baseline of information, we're utilizing the term community health worker as an umbrella term. The American Public Health Association has a really good working definition that we're utilizing, but an umbrella term for folks that we know go by many different names like promotoras de salud, health navigators, patient navigators, so on and so forth. But in terms of their functional role, are really acting as that trusted member of the community who is liaising with healthcare providers, the community member themselves, and social service providers to really provide the health education folks might need, health navigation, connection to those referrals, and providing culturally responsive care in those elements. And so at Children's Hospital, we employ what are called community health navigators. They work in both our inpatient and outpatient settings. And so we're lucky enough to get to see day in and day out the impacts that they have on our patients and families related to reducing health disparities, improving health outcomes. And there's also a bevy of research on how they reduce healthcare costs as well. Zooming out of Children's Hospital in particular, there's a bevy of information related to CHW interventions across the lifespan with pediatric populations. There's a bevy of research around related to youth with asthma and CHW interventions. But there's also for adults with chronic conditions around diabetes, how interventions are impactful. And so zooming out of children's, we've had conversations and policy brainstorm meetings over the last year or so with consumer advocates, different healthcare providers, the CU School of Public Health, obviously community health workers, the statewide alliance of community health workers themselves, digging into sustainability of this workforce in particular. What we've heard from other folks is oftentimes these positions are short-term grant funded, which it's always great to have grant dollars on the front end. But when those end, they often lack the capability, financially speaking, to keep these folks on staff and continue realizing their value and impact on their teams. And so in analyzing what other states have done to date and what levers and tools we have available to us when thinking around sustainability, landed on Medicaid reimbursement as being one of the tools that we can use as a state moving forward. And so what you'll find in Senate Bill 2 is it lays out a process for the Department of Healthcare Policy and Finance, which is our state Medicaid department, to apply for what's known as a state plan amendment. And that, I'm going to shorten it and call it a SPA, but that's what they have to send to CMS, the federal authorities, to have it approved to start reimbursing for some of the services that community health workers provide. So we have a timeline for HCPF to submit that by, and then also within the bill lays out that HCPF must hold stakeholdering meetings with a bevy of different individuals to work through the nitty-gritty details of that state plan amendment. When you're thinking about a state plan amendment at a high level, there's a couple categories that we have to think through. One are the covered services and non-covered services that a CHW provides. And certainly will not be everything under the sun that we know a CHW does day in and day out, but at a high level, other states have covered health education, health navigation, and referral to community-based resources. Non-covered services, this will be a position that doesn't require a license and is non-clinical. So anything that goes above that level of care is going to fall out of a community health worker covered services piece. The second thing we have to think through as a state is you have to showcase the minimum qualifications a CHW has to meet in order to turn on Medicaid reimbursement, for lack of a better way of putting it. We're lucky as a state, the Colorado Department of Public Health and Environment over the last decade or so has done some work in creating a voluntary health navigator registry. They're working on changing the terminology from health navigator to community health worker. And so we're hoping to leverage that state infrastructure that already exists when thinking through the minimum qualifications. Other states have also laid out work experience pathways. So say a CHW has 2,000 hours of service, hours of work to date. Typically they'll get a longer, like a year, year and a half, 2 years before going through the process to be registry listed and still count. The last thing that we have to think through as a state is reimbursement methodology. So, what billing codes, what supervising provider, at what rate, how much. So very important details, not to gloss over them, but all those details are meant to be worked through further in the stakeholder process, meant for it to be public. We know that this issue has been percolating for quite some time. And so we want to make sure that, that public forum is given to really work through each issue, making sure that we are not creating, barriers to entry when it comes to this workforce. And then we also know, not all will go through this process. And Medicaid reimbursement is obviously not the end all be all when we think about sustainability, but it is one tool that we do have available. And so that's what's in the bill. It has been introduced. We're still waiting on a first committee hearing date. But I will pause there if there's any questions on this bill specifically. And then I'm also happy to chat a bit about housing or food security bills if helpful, but I think for sake of time, I'll keep it there for now.
Okay, well, and the last thing, if there are any other questions, and otherwise we're happy to to kick it over to our next panelist. But if you are interested in kind of staying plugged into the work that we're doing, you can sign up to be a child health champion. This is our grassroots network that we use to keep folks up to date on kids' health policy. And we send out action alerts that are super easy on just like what bills we're working on and how you can get involved if you are interested. No pressure either way, but I wanted to share that in case folks are curious. That's everything that we had.
Awesome. Thank you both so much. There is a question that came to me in the chat. for Andrea. Is it Andrea or Andrea?
It's Andrea. We're
Andrea, okay. And around the terminology, community health worker versus care navigator, how that works. AHA has a care navigator group, but which we kind of focused specifically on that term, but can you just talk a little bit about that terminology and the difference in terminology?
Yeah, I think there's overlap in terminology. And I think the reason why we're using it as an umbrella term is to encapsulate folks that we know go by many different names in many different systems, but functionally are providing that same work. I think it's important when thinking through the Medicaid reimbursement piece that, that community health worker within their system, right, might still be going by, and on our team, community health navigators, but they might have something next to it like CHW credentialed or something like that to showcase, at least to the state, that they have met those minimum requirements. And so I think for folks who might go by many different names, it's ultimately will be up to them, if they want to go through, become registry listed, and become someone who can have, their services be billable through Medicaid. And I know it's confusing using an umbrella term like that. It's new. I think we're moving along with the national nomenclature on that piece as more and more states are moving forward with applying state plan amendments. They're utilizing that umbrella term. But I think there's continuous education among stakeholders, among employers of CHWs to better break that down, beyond just this bill.
I will move to Jarett Hughes, and thanks, Jarett, for being here. Alli and Andrea, thank you so much for the information. It's really helpful.
Yeah, thanks, Joe. Maybe transitioning across the life course, if you will, a little bit for some of my focus, but I think, an important reality and a lot of my work focused on aging and older adults is kind of that full lifespan perspective. So whether or not we're talking about, experiences in our, adverse early childhood experiences or, those experiences in our 10s, 20s, 30s, 40s, 50s that impact outcomes in our 60s, 70s, and 80s. So I'm happy to be here today. I've been with the governor's office just over 2 years, and originally came in as a senior policy advisor focused on kind of with that demographic lens focused on aging and older adults, and recently have transitioned into a deputy policy director role, in addition to kind of maintaining some of that workforce, traditional kind of workforce I've been dealing with over the last 2 years. So I know Joe and I have tried to connect both of our backgrounds in gerontology over the years. And so always like to keep AHA apprised of things during session. So I will move, I've got a lot of information in here, but I just kind of dumped a lot in for folks who want to poke around afterwards. So this is all bills that we signed after the 2022 legislative session. So it was a very busy one coming out of the pandemic. We had a lot of specific related kind of public health, some long-term care related items. So if you want to kind of poke around and look into these, obviously I wanted to put them out there for you. You can go to the General Assembly's website and kind of find really more information than you could ever really want there. I want to start off a little bit, we had State of the State, about a month or so ago. And I think really kind of acknowledging that we're moving into our second term and kind of setting the stage for kind of what the next 4 years look like. And what were some of those takeaways that I think overlap directly with kind of that aging and disability specific population. And I think one of the things that we have heard, I think time and time again, and I'll move relatively quickly so we can get back to Alli and Andrea and talk about a little bit more on the housing side of things, because that's really going to be one of the primary focuses as we move forward. And I think the governor really equating housing as public health and housing as equity. And I think you don't have to go very far around the Capitol or kind of in the metro area to kind of see, I think, the impacts of associated with affordability issues in the state and kind of what the ultimate impact has been there with regards to health. And so when we think about kind of social determinants of health, why it's taken us this long to talk about housing and kind of nutrition and all these pieces that are so fundamental to kind of our general well-being as being fundamental to policy. We could obviously debate that, but I think really acknowledging that this is something that we're moving forward with. And I think, obviously I know that the children's team probably works very closely with our Lieutenant Governor's office and the Office of State Money and Healthcare. And so I think trying to think about how we could be more kind of robust and comprehensive as we seek to address a lot of these issues. I think, I don't need to talk through each one of these specifically, but I think one of the things that the governor has always tried to kind of lead with has been this notion of a Colorado for all. And I think regardless of your age, ethnicity, gender, sexual orientation, ability, creating a state where individuals can thrive and are accepted. I think obviously we have a lot of work to do kind of on that front, but I think it's all work that we're lined up and ready to continue forward with. So on this equity side of things, I'm going to talk a little bit about our budget. So, not to belabor it because the budget process is not an exciting thing, but it's a very important thing. We were one of the first states to really have our Office of State Planning and Budgeting, which are kind of within the governor's office. We have a policy team, we have Office of State Planning and Budgeting, we have operations, communications, et cetera. But the budget, Office of State Planning and Budgeting is really responsible for developing the November 1st budget request and then the January budget request as well. And so throughout kind of the process, we've made sure to try to apply kind of the equity lens to a lot of that work. And I think, again, all within the spirit of kind of our pursuit of a Colorado for all. So when we're evaluating budget requests from our state departments, kind of asking for what are the impacts in specific populations, what are your considerations for historical gaps or historical inequities, and how is this addressing those? So I think this is just kind of a framework that we have been able to apply to, what we consider obviously a very kind of standard operating procedure within any governor's office, but really kind of leading the way here. And I think big kudos and shout out to our budget office for leading some of the work there. So this is also just here to help you kind of a how-to guide, if you will. So finding things within the budget is not particularly easy. So I kind of mapped out some of the steps here that you could go through if you want to poke around and really get into the weeds. So I'm not going to talk through this specifically because we could be here for much longer than the next 30 minutes, but essentially kind of the top line takeaway is really, across, the Department of Public Health and Environment, Labor Employment, Local Affairs, our Department of Healthcare Policy and Financing, Human Services, we're looking to make over about $130 million worth of new investments that directly support a lot of our work that aligns with the Lifelong Colorado initiative. And so Lifelong Colorado is really kind of our overarching initiative that aims to support community living and has that kind of life course focus that really kind of has that lens on later life. So here we see a little bit around SNAP and adult protective services. And then I think importantly here, when we get to our Department of Healthcare Policy and Financing, which is specifically our state Medicaid agency, you see here we have some case management redesign, but then this provider rates adjustment decision item right here, R7, is a really big one. And it has a lot of different providers lumped into it, and then it does a lot of different things within there. So it's a relatively complex one, but I think it's a really important one because it deals specifically with how we reimburse for skilled nursing care. And it also has specifically carved out to support base wage increases for our home and community-based service direct care workers. So coming out of the pandemic, I don't think any of us need to, I don't need to belabor the impact that COVID had on long-term care and skilled nursing specifically. And so essentially, as we've kind of described it, we have, we have a system that has really kind of been regulated by policies that are particularly punitive. And I think the goal has been to kind of, fine or regulate providers into compliance, which works sometimes, but it also doesn't work in a lot of instances. And so I think we're trying to be, a bit more solutions-based and kind of asking for transparency and kind of, general operations, accounting, and then also really kind of getting to the point where we're paying for the outcomes that we want to see. We want to be better about incentivizing single occupancy rooms. We want to be better about taking care of older adults that have complex medical and behavioral health needs. I think if we were coming out, we hadn't been dealing with the pandemic the last 3 years. I think the thing that would be top of mind for kind of the long-term care industry is the increasing prevalence of adults that have, whether or not it's COPD or a mobility issue, and then also a co-occurring diagnosis of schizophrenia or some other behavioral health or serious mental illness. So better addressing kind of that intersection is really important. We can't do all that only in state law. There's going to be some issues we have to tackle with our federal partners at CMS, but this provider rate adjustment really kind of gets us on a track to pay for what we want to see kind of in long-term care. So this is a really, really big piece, and there will be some corresponding legislation coming down the pipe relatively soon aligned with this. And then obviously better supporting our direct care workers is something that I think all of us can kind of rally behind, and something that will be a priority as we move forward, because with kind of our general understanding of where our demographics are headed, we'll have more adults over the age of 60 this year than Coloradans under the age of 18, and that demographic switch has never happened before, and that gap only continues to widen until 2050, which is as far out as the state demographer projects. But so we know that we're going to have this pressure on our healthcare workforce. How do we support them? How do we intentionally recruit people? How do we keep them in the workforce and take better care of them? This is something else that folks can really dive into if you would like to. So this was a budget amendment that came in kind of the January submission. So without belaboring it, November 1st every year, or the first business day of November, a budget is released. And so that's the governor's initial budget request. And there's always kind of a supplemental budget amendment submission at the very beginning of January. So in that, we had budget amendment 7, which is really focused on community-based access to services. And I think this increases a lot of our internal state capacity to do work within long-term care, help transition people back to the community, and ultimately keep people in the community longer and in the first place. So this implements a lot of different things. And again, it's very nuanced and relatively complicated. And there will be a bill associated with this as well, kind of coming down the pipe, probably in the next, 2 to 3 weeks, any later than that. And we start to get a little bit close to our off ramp. On legislative items, so one of the things that has been pretty top of mind, as I alluded to, is skilled nursing rate reform, and then guardianship is also kind of a particularly pressing item this year. So we have an Office of Public Guardianship at the Judicial Department that is up for review by the legislature. It was originally authorized back in 2017 by House Bill 1087. And when it was originally passed, it was passed without any funding. So they was given a gifts, grants, and donations clause, which is often something that a legislature will do. And then it doesn't create a context for great program development or implementation. So this office, if you will, has gone through a variety of a lot of, accompanying bills to kind of modify, get it up off the ground. And it's up for review this year, but this really does a lot, guardianship services in general, to kind of keep folks out of the hospitals and out of higher acuity care settings. So this is very useful, for example, in our state mental health institutes, whether that's Pueblo or Fort Logan. But again, this is really kind of that intersection of adults that have complex medical needs and then complex behavioral health needs. There's also been, it's been a relatively kind of contentious, I think, conversation around how we move forward with a lot of this. And I think guardianship is a particularly complicated issue, but I think at the end of the day, acknowledge that it's a service that is very much needed. But I think kind of before we get to that, it's really kind of the intervention of last resort. And we really try to focus as much on supportive decision-making as possible. I talked a little bit about skilled nursing rate reform, so I don't need to spend too much more time there. But a lot of the recommendations that we'll see in the ultimate bill are tied to a supplemental bill from last year, House Bill 22-1247. And there's a skilled nursing facility reimbursement report with goals and recommendations. Once I share this out, you should be able to kind of follow the link and take a look at that if you would like some, fun evening reading. We also have a tax credit specific to long-term care purchase coming out of our Legislative Oversight and Tax Policy Committee. I don't need to talk through this one too much. It's relatively straightforward, but I think one, we all understand how expensive long-term care is, or I hope most of us do, in the grand scheme of things. We understand it's not funded by Medicare, and it's essentially out-of-pocket private pay until you get to Medicaid. We also know that folks do not purchase long-term care insurance, and we also know that long-term care insurance providers are having a tough time staying afloat. So there's kind of this duality where we have an insurance product that's underutilized, and we have an insurance product that's hard to reinsure on the back end. So there's a lot to be done here, and this is just one piece of the puzzle. So I think as our population continues to grow proportionally older, these are the types of issues that we're having to tackle and address. And then, I think just to kind of wrap things up here, at least some time for discussion. These are a list of actually, and I'm sorry, maybe this heading right here is a little not entirely accurate. I'll edit that out before I send. So these are non-agency bills that have been brought forward, but not all of the bills on the previous slides were agency agenda items. So that's my own fault, but I want to call that out and then I'll edit it appropriately before sharing with you, Joe. These are just a variety of bills that have been introduced so far that align with work that we have done previously, that align with Lifelong Colorado and our strategic action plan on aging. So there's a lot here. I think a lot of what I have kind of talked about so far has been very healthcare specific. And I think that's, because of the nature of the group and kind of the audience today. But I think a lot of our aging and older adult specific initiatives really try to span kind of a variety of policy areas and really kind of try to take that demographic lens and apply it not only to healthcare, but to transportation and local zoning and housing, to workforce development, whether that be for healthcare workers or keeping older adults in the workforce longer. You think about retirement security and pension issues. So, demography impacts a lot, and it's also said demography is destiny, and so that's kind of an approach that we very much try to bring, or at least that I very much try to bring kind of to our policy analysis across a variety of portfolios. So I appreciate the time, Joe, and I will stop there.
Thanks, Jarett. Really appreciate it. Just kind of going back to the beginning of your presentation, talking about the the equity inquiries that Emma had posted in the chat. Are the equity inquiry questions in a standard form, and can you share those questions with us?
So Emma, I do believe that our budget guidance is posted on the website. I can double check that. And when I say the website, I mean the Office of State Planning and Budgeting's website. I can double check that, but it really is kind of a, it's pretty much like a envision kind of like a spreadsheet, like table type of format where there are some key items and then folks are supposed to fill in. So let me poke around the OSPB site and share that with Joe when I send out my slides. And I can include a few sentences there for you.
Thank you. That'd be great. Other questions, comments, reactions? And there is a chat comment. Senate Bill 23031 does not include optometry or recreation therapy. Can anyone speak to this bill? So Senate Bill 31.
Sandy, I think I can kind of take a swing at that perhaps. I mean, I think the goal is, and perhaps I'm wrong, but are there specific geriatric specializations within recreation therapy and optometry?
I'm just going to unmute. Yes, recreation therapy does have older adult specialization. Optometry, I included not because I can speak to that personally, but a friend of mine specializes in working with older adults with dementia. And she commented that she finds optometrists and ophthalmologists are not aware of the effect that dementia has on eyesight. And she gave me one example of one of her participants who went to an eye doctor. I guess dementia affects your peripheral vision. Beyond that, I really can't speak to that.
No, that makes sense. That's helpful context. So, this is a bill that is really being led by some of our advocacy community with the Colorado Center for Aging, as well as CU Anschutz Multidisciplinary Center for Aging. So
right.
I can't speak specifically as to why they excluded those two items, but I do think that if I had to guess, I imagine kind of in their coordination with the School of Medicine, as well as I think other the institutes of higher education, whether that's CSU or MS Metro, I think they kind of went to the higher ed institutes and asked what bubbles up to you as being kind of a top priority, kind of within kind of your specializations and focus on geriatrics or older adults. And I think the list that you see kind of in that bill is ultimately where they landed. So I think that's, and I guess I wonder to what extent could recreation therapy be lumped in with, well, there's probably not much flexibility around the physical therapy component, but wondering if there is an opportunity there for overlap.
There could be. I think the overlap would happen between recreation therapy and occupational therapy.
Got it.
Occupational therapy is more scientific. You have certain movements you teach them to do. Recreation therapy is more approaching them from the creative, leisure, enjoyment aspect of it. It was just a curious comment, Jarett, more than any, criticism of it. But I was very interested when my friend pointed out the optometry portion of that. And sometimes things, areas may not be included because they just don't realize that there is an effect, particularly in the area of dementia. So I was just more of a curious question. And thank you, Jarett.
Yeah, no, thanks, Jane. It's a good question. I think, we often talk about how, so often, we're trying to get people hearing aids and glasses still, right? And it's like, there's all these bigger things that we're also trying to solve, but there's also some of these fundamentals that we're still lagging behind on.
Right, thanks.
I could jump in real quick. There is quite a bit of research being done at the Anschutz Medical Campus about optometry and dementia. And I have an interview with Dr. Pelik, who is internationally recognized as one of the best on the optometrist side. So I have my website address in the chat if you have an interest, because this is something that people just are not aware of.
Thanks, Dennis. Okay. So then I will swing it back to Alli or Andrea around food insecurity, housing.
Yeah, I can mention a few bills that we're following this session. In the food security space, I would say House Bill 1008, which is around food accessibility. It builds upon a bill that was passed last legislative session, 1380, which was full of American Rescue Plan Act or ARPA dollars coming into our state and that were allocated to create a small business recovery and resilience grant program and a consortium in the Department of Agriculture around small food retailers, small family farms and really connecting across the distribution chain in terms of making food more accessible in small retailers in particular. So 1008 builds upon that good work. It's some wonky tax code. It's decoupling the tax deduction you can claim for business meals. So folks will still be able to claim it on the federal front, but on the Colorado or state level, it will roll into bolstering that grant program and creating a small tax credit for small food retailers to be able to buy what is usually pretty expensive equipment to be able to sell things like fresh fruit and vegetables. That bill made it through its first committee hearing. I want to say it was yesterday, and is on the move. Had a few minor amendments, but again, excited to see that move through and continue to bolster that work from 1380. There also is Senate Bill 27, which is the Food Pantry Assistance Grant Program. This month, the SNAP emergency or extra SNAP benefits will begin to go away. I think what we're hearing across the board is that, for folks who operate food pantries or work with food pantries, we are estimating that we're going to see a surge in need there in particular. So that bill simply extends the program that already exists. In the housing space, there are a bevy of bills across different issue areas from affordability, stability. Right now, we're monitoring or looking into quite a few that are around the eviction process in our state. One of them is House Bill 1186, which allows for remote participation in residential eviction hearings. So it'll allow folks to attend an eviction hearing or choose how they want to attend in person, over video conference, or by phone. So this will help to ensure that folks who might have barriers to attending around their ability to take off work or childcare or transportation, that they have an option to attend that hearing. Otherwise, what we've seen is that they will receive, if folks can't attend or don't have an option or alternative in how to attend, they receive what's known as a default judgment due to that inability. So it's really about accessibility, keeping folks housed where we can, and allowing for alternative options to clue into those. Another bill that we're paying attention to is House Bill 1171. It's around just cause requirement eviction of residential tenants. And so this one in particular will define in state statute what is a just cause for a landlord to evict a tenant on legal grounds. Those can be around non-payment of rent, substantial lease violation, criminal activity, in terms of just cause. And so we're excited to see that move forward. It hasn't had a first committee hearing just yet. There's another bill around evictions, 1120, which is around eviction protections as well, but this one is more focused on folks who are receiving supplemental security income, federal social security disability, or cash assistance through TANF. It's around allowing for a mediation process to happen between a landlord and that tenant before an eviction is moved forward. Oftentimes when those mediations are allowed to happen, it removes some of the power dynamics that naturally exist between landlord and tenants, puts them on a level playing ground, and allows for creative opportunities or solutions in moving forward for the tenant and landlord to work together. And then one more bill that we're looking into is House Bill 1095, which is prohibited provisions in rental agreements. And so lays out, as the title says, what's allowable within a rental agreement. And so gets rid of fee shifting clauses, doesn't allow a tenant to waive their right to trial by jury, some fairly essential legal aspects that we think should stay in place. And so I know those are a little bit more legally jargony on those pieces, but when thinking about, the most vulnerable populations and the eviction processes that exist in our state, trying to create them to be more fair and accessible and to keep folks housed, especially families with kids, because we know the impact that has on their health overall. Otherwise, as I mentioned, there are many other bills in terms of affordability, in terms of, what the state is doing to look into building affordable housing, so on and so forth. And then last year, there were a bevy of ARPA bills that are still being stood up in terms of those avenues of housing as well. But those are some of the things that we're following in terms of nexus to kids and families in our state and their health when it comes to food security and housing. Sorry, that was a little rambling.
No, not at all. There's lots happening, so it's good to have these particular things kind of brought to our attention. So I really appreciate that.
And I think maybe just to, it was mentioned kind of the SNAP benefit enhancement kind of, rolling off at the end of this month. And, on Monday, on Monday, we were actually successful in getting a $14 million amendment attached to the supplemental for the Department of Human Services, which will go towards the Food Pantry Assistance Grant Program. And so the goal being to kind of, there was no kind of like easy, quick way there's no direct like state path to plus up SNAP benefits. So we kind of had to think somewhat holistically around how can we get money down to the local level to support food security programming. And so kind of going through the food banks and the food pantries is really kind of the quickest and best way to get that out. So we were happy to see the legislature move with that. And then one of the bills that Joe actually flagged, 1158, creates the Commodity Supplemental Food Program at the Department of Human Services. So this actually mirrors a federal program. And if you think about kind of food boxes is kind of the way I would describe it, and something that our Department of Human Services already does. It is specific to older adults, and it's in committee right now. I think it was in committee at 1:30. So see where that one goes. But I think I think maybe the theme being here, food security and nutrition programming is very popular, and it's a huge issue across the state. And so I think whether or not it's potentially this or through kind of the food pantry assistance grants and working through the food banks, there's just a lot of movement there.
Thanks, Jarett. Fingers crossed for that. Yeah, thank you.
Thanks everyone for joining. Mandy Ashley with the Aurora Health Alliance. Just a reminder to all of you, if there are pieces of legislation that you think align well with the Aurora Health Alliance mission to improve access for all, please let us know. We have an advocacy committee. We take positions on bills. We don't have the capacity to be lobbying with ever-changing legislation, but if there's sign-on letters and things like that, that is something that's within our purview. We're happy to take a look at it and run it through our advocacy committee. Thank you.
Well, I want to first say thank you, Alli, Andrea, Jarett. Thank you so much for this information. If you have slides, we'd love to share them out to folks. I know there's going to be a lot of stuff happening in the next few weeks and few months. So, we're always open to updates on things, time at other future meetings. So please let us know, but thank you so much. So if there are folks that do want to make some announcements, please feel free.
Joe, I have an announcement. This is Jeannie Davis. The relationship that we've developed with the Mission Viejo Library, it's a pilot program for our intergenerational committee. They are having an event, the Mission Viejo Library, in conjunction with the Aurora Commission for Older Adults. It's called Generational Split, and it's going to be held on Saturday, February 25th from 2 to 4 p.m. at the Mission Viejo Library. It has to do with how well you know the different generations. And so it's going to be a multi-generational trivia game that the library is creating, and to celebrate afterwards with building your own banana split station. So that should be a lot of fun. And then the other thing that I'd like to announce is that as part of our partnership, the Mission Viejo Library is hosting a series every Monday at 10:30 a.m. It's called BOAT. The program they've developed is called BOAT, Bringing Older Adults Together. Conversation, puzzles, and refreshments. And it's just a networking type of an event for older adults.
And that's every Monday, Jeannie?
every Monday at 10:30. And you can register for each of those on the library website, the city's library website.
Awesome.
Thank you.
Thank you. Yeah, thank you.
I could jump in with an announcement.
Sure.
I'm on the Behavioral Health Planning and Advisory Council for Colorado. I'm a new member. And they put me on the a membership committee because we're lacking a number of people to make up 45-seat council. And I'm going to be doing some promoting of the council, but also I'm going to be doing a lot of recruiting. So if people have an interest in behavioral health and want to be on the council, get in touch with me. I, be more than happy to start collecting names. In June, we're going to have a pretty big push to fill a number of empty seats. The council has bylaws that require 3-year membership with 1 renewal. And then after that, you have to come off the council. So there's been an attrition because of COVID more than anything else. And I'm going to work diligently to get that all punched up. So thank you.
Thank you. Thanks for serving on that committee. That's great. Great to hear. Thank you all so much for joining us, and we hope to see you at a future meeting.